Hi.
Hey, how's it going?
Hey, not bad. How are you?
I'm good.
Good. So I'm glad that you made it. I have a patient here, and he is a 33-year-old male. He came in with his mom, and they have some questions about their injury. So he came in after hitting his head from falling off a bike with his helmet on about 2 days ago. His mom noticed that he was behaving funny. He has a headache, increased drowsiness. He feels confused sometimes. And he just got back from CT, and they determined that he has a small subdural hematoma.
Okay.
So they decided that they want to admit him to the ICU for observation and monitoring for the bleed. His name is Clyde. He's confused because he said that when he fell, he was feeling fine, and he doesn't understand why he's here after a few days. So would you go in there and explain to him and his mom why he's being admitted? And also, can you answer some of their questions? They don't really seem to understand what's going on, how serious the situation is, and why he's going to be admitted for the night.
Okay.
Great.
Yeah, sure, girl.
Thank you.
You're welcome. Hello.
Hello.
My name's Ashley. I'm going to be your nurse today. Wonderful. Nice to meet you.
Nice to meet you.
Oh, hello.
I'm
Nice to
Bonnie.
meet you. I'm Ashley.
This is my mother.
Yeah, okay. Hello. Nice to meet you
Nice to
guys.
meet
Can
you.
you tell me your first and last name and date of birth real quick just before we get started?
Clyde Barker, April 28th, 1982.
Oh, okay. Wonderful.
So the doctor said that he had a subdural hematoma. We're not really understanding what that means.
Yeah,
Can you
yeah.
explain that to us?
Yeah, absolutely. That's a wonderful question. So first of all, I just wanted to say that it's really a good thing that you guys are here today. I'm glad you came in. So I heard, Clyde, you had a bicycle accident. How are you feeling?
I'm feeling okay. I got a little bit of a headache, and I've been a little bit confused recently, I guess. Honestly, I'm just really tired. I kind of want to go home and go to bed. But I guess they told me that I have to stay the night here, and I don't really understand exactly kind of what's going on. So could you maybe tell me?
Yeah,
what the
definitely.
deal is?
So when you hit your head and fell off your bike, it caused a vein to start bleeding inside your skull. So this is similar to what happens when you get a bruise on your body that indicates there's some blood leaking out beneath the surface. This is happening just inside your brain. Just like a regular bruise, it takes a little while to show up. So that would explain why you felt okay at first and then your symptoms were getting worse over time. So the term subdural hematoma, that's really just a fancy medical term that we use to help us determine the location of the bleed. The reason we're keeping you here overnight is because this is a serious injury, even though yours is small. If the bleeding continues to get worse, that can lead to increased pressure inside of your skull. So.
Oh, okay. I see. Okay, I kind of get it. Like basically, I fell off my bike, and when I hit my head, I created some bleeding inside my skull, right? Between the skull and the brain.
Yeah.
And if I keep bleeding, I'll probably get some more pressure in there.
Yeah.
Okay.
Yeah, very good.
Okay.
Excellent.
That sounds scary. What do you mean pressure inside the skull?
So if you think of your skull, it's really hard and doesn't have the ability to expand. So if the bleeding continues, that's going to push down on his brain, possibly cutting off the flow of oxygen and causing further damage, and could even lead to permanent brain damage, which is why we want to watch him. So in the event that that does occur, we're here to intervene.
Okay, that all makes sense. What difference does it make knowing where the bleed is, he's bleeding from?
Yeah, great question. So there's 3 protective layers surrounding your brain to keep it safe. So his brain is essentially bleeding underneath a thick layer called the dura, and that's really just for us to understand where it's located inside of his head and how we could possibly manage treatment if it exceeded further. So.
What does that mean, Mommy?
Oh, sweetie, let Mama listen, okay?
Okay.
So what if the bleeding gets worse? How would you know?
Yeah, that's a great question, and definitely information we need you guys to know. So for you, being his mom, it's really important that you look for increased drowsiness, numbness in the extremities, vision problems, possible increasing headache, nausea and vomiting. But the #1 sign that we're going to look for while we observe you for the next 24 hours is any change or decrease in your perceived level of consciousness. That's very important because that can be a sign of further bleeding and further pressure inside of your skull.
I have been getting drowsy, so
Yeah,
is that kind
that's
of what we're looking for?
Yeah, definitely, and that's normal to get a little sleepy after a head injury, but yeah, we don't want that to go any further. So.
Okay, so you're saying that if his headaches gets worse, or if he starts vomiting, starts acting funny, gets sleepier, that his bleeding is getting worse?
hours?
Yeah, excellent. Good job. Yeah, that's wonderful. So if that happens while he's here, we'll reassess the situation and go from there. We're not expecting that to happen. It is a small bleed, but we just want to make sure that you're aware that that is a possibility. So.
Okay, thank you for letting us know. Is there anything I can do to keep my precious darling safe?
Yeah, there are. We have lots of things that you can do once you're discharged and return home to make sure that you don't exacerbate this problem any further. No drinking, no alcohol.
Oh, he doesn't drink.
Of course
Okay.
not.
Yeah, such a good boy.
Well, then we don't need to worry about that. We don't want him driving until he's cleared by the neurosurgeon and we know that he is not a risk to himself or other people on the road. Some other things to consider are keeping his head elevated at least 30 degrees while he's sleeping, and avoid any extra hot showers or baths. This can increase blood circulation and also increase the blood that's in the brain, and what we're trying to do is reduce that pressure inside of his head. And most importantly, no contact sports, no physical exertion. This includes riding your bike.
I can't ride
Good,
my bike.
I like that.
Yeah, I thought you might like that, yeah.
Oh, don't worry. I'll stay right by his side and make sure he's not throwing up, going blind, falling asleep on me, or losing his brain. I'll get his bed nice and ready with lots of pillows to rest his beautiful head on, and personally test all of his bath water.
You're the best mommy ever.
All right, excellent. So yeah, I mean, we can go over this tomorrow in discharge, but yeah, your number one things: vision problems, nausea and vomiting, numbness of extremities, and any increase in his tired level of feeling tired and drowsiness. Yeah, do you have any more questions for me?
I think that's all. Thank you so much.
Okay, excellent. Do you have any more questions for me, Clyde?
I don't think so, not right now, but there's still a lot of stuff to remember, especially what's going on. Do you maybe have something I can read or look at?
Oh yeah,
like a handout?
yeah, absolutely. We have a great handout on subdural hematomas. I'll make sure to get you one today so that you guys can look it over, and you can also take it with you when you leave tomorrow, so you won't forget any of the stuff that we talked about, okay?
Awesome,
Okay,
thank you.
All right. Yeah, you're welcome.
Thank you so much.
Good
Did
luck.
you want some juice, sweetie?
Oh yeah, some juice would be
Oh
good.
yeah, what would you like? Apple juice? Is
Apple juice
Oh,
would be
okay,
fantastic.
wonderful. And a straw, perhaps?
straw, two of
okay,
them would be
great.
good.
Okay.
Thank you, Ashley.
You guys gonna share that together?
Probably.
Okay.
Thank you, Ashley.
You're welcome.